Hello, and welcome to the Body Fusion Therapy Podcast. I'm your host, Dr. Heather Demirci. In today's episode, we're going to be talking about headaches. A lot of people suffer from them. Sometimes they're more chronic. Sometimes they're just a one-off. The hard thing about trying to treat headaches is that there are over 300 different classified headaches out there. So to say that there's one thing that's like the magic bullet that will cure it all just isn't realistic. So in today's episode, I'm going to cover a few different types of headaches that are out there. Then also some common referral patterns for headaches, how to treat them. And finally, I'll talk about how you can document your headaches so that if you need to go to your medical provider to talk about how to treat them, they'll be armed with more information so they can help you figure out what your potential cause of your headache is and then the treatment that should follow with it. Obviously, there are too many different types of headaches to cover in this episode, so we're just going to focus on a few. Today, I'm going to be talking about tension headaches, cervicogenic, exertion, TMJ-related or jaw-related ones. If you're a female, ones that are associated with your menstrual cycle, and then finally, migraines. Tension headaches are usually characterized by this dull, achy pain. There's no throbbing or pulsating properties to a tension headache, and you have most likely more sensitivity on your scalp and sometimes on your face as well. So tension headaches are usually when people are feeling stressed out. They'll kind of complain of this tension headache, and sometimes they'll complain about it as is like a band around their head. That's usually where the area that they're talking about more of this tension headache. Cervicogenic headaches are headaches they're coming from the neck. So it's actually an issue with the neck that's causing the pain into the skull. So the pain usually starts at the base of the skull and the back of the head and follows along each side to the top of the head. And occasionally it can go into the forehead. This is usually more of a compression onto right at the base of the skull in the area that we call the suboccipital muscles. So suboccipital being just below the occiput, which is the bone that's in the back of the head. Exertion headaches are usually after these quick bursts of physical activity, like sprinting or lifting of heavy objects. And this is the one that's going to be more this throbbing, pulsating like sensation. And it's going to be a lot of pressure deep inside your head. They usually dissipate quickly though. So exertion headaches will come on really fast. But then as your blood pressure and your heart rate starts to come down, then they'll usually start to alleviate pretty quickly. TMJ headaches. So this is caused from clenching of your jaw muscles. It can also be aggravated by a popping of your jaw as well. So when people open up their mouths and there's a popping sensation, it almost feels like the jaw is dislocating on one side. These can cause issues that usually the headache is felt in the temples and along the jawline, and occasionally can also cause pretty significant ear pain as well. I'm seeing these headaches more often right now with my patients because of wearing masks. So when people are wearing masks and they're not used to it, then they're trying to take a deep breath in. They will jut out their bottom jaw to try to move the mask away from their mouth so then they can get more air in. So a lot of people are suffering from this more TMJ headache, more of this temple headache right now because of the mask wearing. Females will also suffer from headaches that can be associated with their menstrual cycles. Now, these could be every month they're getting, so it's usually cyclical that you notice it every month. And every month could be around your menstruation, or the actual period, the menses, or you could notice it during ovulation. If you notice the headache is coming on around time of ovulation, it's not necessarily every month that can occur. It could also be every other month, and that is because one month you ovulate from one ovary and the next month you ovulate from the other ovary. So if the cause is from an ovary restriction, it could be that you only feel that headache every other month, not necessarily every month. Migraines are their own beast of headaches. These are intense, pulsating in from deep inside your head. It can also lead to visual changes. So you'll hear people talk about these auras. So it could be flickering of light. It could be a little bit of just kind of different shading of light, usually more in the periphery that they'll suffer this from. Migraine sufferers will also say that they have a lot of light and sound sensitivity, so photo and phonosensitivity. Migraines can last up to a couple days, and they have a significant impact on your ability to carry out your daily activities. I think a lot of people feel that when they have a headache, they'll just automatically say it's a migraine. You need to understand migraines are really debilitating. People are not able to function when they're having a migraine, and you know if you're a migraine sufferer. So most headaches aren't going to be migraines. They're going to be these other causes and these other types of headaches that I've already discussed. Now, migraines can be really difficult to treat because we don't really know exactly how they're caused. And there are some great medications out there on the market now. I'm not going to cover those because that's not my practice axe. That's not my wheelhouse of information. But there is a way that physical therapy can help with migraine sufferers. And we'll talk about that when we go to treatment. Now that you have a little bit more information about the different types of headaches, well, a few of the different types of headaches, because remember, over 300, that would be a very long podcast to try to cover. So I just wanted to give you an idea of the characteristics of a few of them. Now let's talk about something called referral patterns. Now, this is the body's ventriloquist dummy, where the source of the pain is one place in the body while the pain is felt elsewhere. Very frustrating, I know. So as a few examples, that would be when men feel pain down their left arm when they're having a heart attack. Another common one you'll see is that they'll have pain in between their shoulder blades when it's actually a gallbladder issue. The issue with referral patterns is that if you don't know what they are, it's really hard to figure out why you're not getting better. So I would have patients come into my office that are complaining of this mid-thoracic pain, this pain between their shoulder blades. And when I move them, they're moving fine in that area. But then when I go and treat the gallbladder, then their pain alleviates. So these common referral patterns should be known when we're talking about headaches, because if you're trying to treat your head and that's not helping, or you're trying different medications to help these different types of headaches, but you're not getting relief, it could be because there's actually a referral pattern that is the issue. Now, when I'm going to be talking about these common referral patterns that they have for headaches, I'm going to be mentioning some muscles. Now, I will explain to people that aren't as anatomically versed where in general these muscles are, and then I'm also going to say what the actual muscles are. So those that are more anatomically versed, then they'll be able to know exactly what I'm talking about. The first referral pattern is from the suboccipital muscles. The suboccipitals are at the base of the skull, kind of going off to the side of the base of the skull and attaching onto the neck. The pain associated from the referral pattern of the suboccipitals is around the sides of the head, almost like if you were wearing a blindfold, and it goes to the sides of the eyes. Another one of the referral patterns is from the semispinalis capitis. So while the suboccipitals are more kind of going in a V from the neck to the sides of the back of the skull, the semispinalis capitis is actually right in the center of the spine, attaching on the skull and going all the way down into your mid-thoracic, so in between your shoulder blades. The pain you'll be feeling if the semispinalis capitis is the problem is concentrated at the temples, so right at the sides of the eyes. Now, do you understand why these referral patterns can be really annoying? That something going all the way down to your mid-thoracic spine or right between your shoulder blades could be causing the pain right by your temples? Yeah, that's why we're going over these right now. The next one is the semispinalis cervicus. So this muscle actually isn't attaching onto the skull, but it's right next to the semispinalis capitis, this last one. This one, you just feel in the back of the head. So this is more of that referral pattern with more of that cervicogenic headache that I was talking about, where it's coming from the neck. I have also seen the semispinalis cervicus actually then wrapped around to the front of the head, but usually it's focused right in the back of the head is the pain from the semispinalis cervicus. Next up, the sternocleidomastoid, or the SCM. This is the big muscle in the front of your neck where if you were to turn your head, so if you wanted to feel for the left SCM, you would turn your head to the right and then bend your head down a little bit. And the muscle that pops out in the front is called your SCM. So issues with the SCM, you'll feel pain on the back of the head and around the eyes and into the forehead. So this one's actually going to be more of that like ocular pain sort of headache. It could be coming from the SCM. The traps are up next, the trapezius muscles. So this is the big muscle that you see when going down to your shoulder, from your head down to your shoulder. That's on your back. This muscle, if it's the problem, you'll feel the pain in the temples and in the jaw and behind the ear. The temporalis muscle, this is actually on your skull itself. It's if you were to feel by your temple and then to really clench your jaw, that muscle that pops out is your temporalis. The referral pattern for the temporalis would be the sides of the head and then into the upper teeth. So because the temporalis muscle is really important with chewing, or what we call mastication, you'll feel this actually into your upper teeth. It could almost feel like a little bit of a sinus headache too, a like lower kind of cheekbone sinus headache could be coming from the temporalis muscle. The splenius capitis muscle is a big, thick muscle that is on your spine on the back, and it attaches from kind of lower cervical spine up onto the skull. This is going to be more superficial than the splenius capitis or splenius cervicus. And referral pattern from this is going to be smack dab on the top of the head. This last one isn't technically a referral pattern, but I want to mention it anyways. And this is for all those females out there that have that menstrual cycle headache that's happening. Your ovaries have an extra piece of fascia or connective tissue that goes from the ovaries, travels up through the trunk, and actually attaches onto the base of the skull. So if you have headache with either menstruation or your menses, the bleeding, or with ovulation, it might not be hormonally based. It could actually be a restriction of that piece of fascia around your ovaries. So during menstruation, the menses, when you're actually bleeding, the uterus is contracting to shed its lining. And if there is this adhesion or tightness of this fascia that's coming from the ovaries, it will actually get pulled on and then pulled on the base of the skull. If this piece of fascia is the cause of your menstrual cycle headache, the pain is usually felt at the base of the skull, and then it wraps around the top of the head and can go into the forehead. It could be that you only feel pain on one side of your head, that your headache's a little bit more one-sided during your menstrual cycle. But usually if you have headaches that are associated with your menses or your period, then you'll feel it on both sides. But if the pain is more during ovulation, then it can be that you only feel pain on one side of your head and it's every other month. Or it could be that you feel pain, you have a headache, but it is only every other month. So it can be that you have these restrictions of one specific ovary that you're ovulating from that is causing the pain, and the pain can be felt on both sides or just on one side. Now that you're armed with the knowledge of the different types of headaches and how they are characterized and these common referral patterns, how do we treat headaches? The first place I suggest going is actually looking and assessing the muscles on the cranium or the skull itself. Now, even if you are not a medical professional, you can just Google the anatomy of the skull and see where the muscles are. There's not a lot of them, especially on the kind of more back part of the head or not on the face. So you can go through those and kind of palpate or touch those areas, see if any of them, as you touch them and kind of push into them, if any of them cause these similar types of feelings you have when you get a headache. If they do, then you can work on massaging those specific areas, and you know they're almost like a tender point that could be triggering your headache symptoms. You also want to look at the muscles of the neck. Now, looking back at the common referral patterns I just talked about, the majority of them are attaching onto the cervical spine or the neck. So the neck muscles need to be assessed. Now, if I was to get the most bang for my buck, I didn't have a lot of time, I would just be palpating around the base of the skull, starting from the sides and going back to the center to see if any of those areas kind of cause a tender point. Now, that's easier than trying to trace all the way down these individual muscles. It's a lot easier just to go along the base of that skull and see if any of them cause the pain, and you can do massage techniques there. If you do find that your headaches are coming from more of a cervical region or the neck, then it's not enough just to treat the muscles. You also need to look at the joint alignment, and this needs to be done by a medical professional that knows what they're doing. Now, the muscles are what move the joints or the bones. So you can't just assume that because you get the muscles moving better, that the joints are in a neutral position of where they should be. They could still be out, and then the muscles will start to pull again because of this dysfunction of the alignment. So yet again, if you're going to get the most bang for your buck here, I would go after treating the upper cervical spine. So C1, C2, and parts of C3 as well. So don't forget that the muscles could be the cause of your pain, but the underlying issue could be a joint alignment problem. So that needs to be assessed and treated as well. If you've kind of decided that the pain that you're having from these headaches is more caused from the jaw or that TMJ headache that I was talking about, then you want to look at the muscles around chewing or mastication. So we talked about one of them in the referral patterns, which is the temporalis muscle. And you can see that goes from your temple and kind of fans back along the side of your skull. Next up is your masseter muscle. So this muscle is going vertically along your face, and it's at the back of the jaw, kind of going from the ear down to the angle of the jaw in the back. Now, this one is great for kind of doing a stripping motion. So you kind of just want to go along the line of that muscle, following along and just feeling for tensions as you go. Next up would be treating your pterygoid muscles. So the pterygoid muscles, the best way to do it is actually to go underneath your jawline, trying to sink in underneath the bone, like behind the bone of your jaw, and finding tensions as you go from the front of your chin all the way back to that back angle of the jaw, and just trying to mobilize those tissues there. Finally, if you're still having issues, you can actually get your fingers into your mouth and just trying to pull on your cheek muscles and trying to pull them out. This is going to get your buccinator or buccinator, depends on how you say it, tomato. And all these muscles are associated with your jaw and can be causing that temporal mandibular joint issue. If you're a person whose jaw pops when you open it and open it really wide, you might actually have something called TMJ disorder or TMD. If you think this might be you, it's important to first assess to see what is the cause of the popping of the jaw. So there's two different scenarios here. It could be that the side that's popping is having to pop because the other side of your jaw is actually really restricted and not opening properly. So then it almost causes a force of the opposite side to pop and move forward. Or it could be that your muscles aren't very strong to know how to keep you properly in joint when you're opening your mouth. The way to assess which category you fall into is to first open your mouth fully and kind of feel for the popping of the jaw and where that occurs. And then close your mouth, press the tongue to the roof of your mouth, and then open again. If you have the popping still, even with your tongue holding strong to the roof of your mouth, then the issue is more of a joint restriction on the opposite side from the popping jaw. Now, this needs to be treated more from someone that knows how to treat TMJ disorder. So that's going to be going to a physical therapist and possibly getting a dentist involved. If you're the other category where it doesn't pop anymore, then this is more of a muscular retraining situation. So you need to learn how to retrain your muscles to hold your joint in the right place and kind of spin within the joint itself rather than translating forward and causing that popping to occur. So you do this by having that same position where your tongue stays on the roof of your mouth, and you're going to put your thumbs underneath your chin, and you're going to resist your chin opening by your thumbs pushing upwards. And then you're going to open your mouth as far as you can with your tongue staying on the roof of your mouth. Then you're going to slowly allow your thumbs to close your jaw. So your jaw's still going to be trying to fight to stay open, but your thumbs are going to win to allow you to close. Doing this about 5 to 6 times and multiple times a day will help to improve the muscle education as to how to open your jaw. But if you think that the TMJ might be more of the cause of your pain, you might need to get a dentist involved to do some sort of appliance in your mouth to start to decrease the tension on the joint itself and allow for healing to occur. So this might be a situation where you need to find not only a physical therapist that can help you with this, but also a dentist to have this more multidisciplinary approach. If you're one of the women that falls into the menstruation category for the reason for your headaches, you're probably going to need to see a physical therapist that understands the anatomy of the reproductive organs to help mobilize around the ovaries and the uterus to decrease the tension on that fascia. This is not something that I suggest people try to do on their own. It's only under the supervision of someone that's a medically trained professional that understands the anatomy that this should be done. Finally, let's talk about how physical therapy can help with migraines. A lot of migraines, I think, might be associated with a trigeminal neuralgia. So the trigeminal nerve is your fifth cranial nerve, and it goes to the face. So there's three different branches. One goes to covers the whole forehead, and then underneath the eye, kind of the cheekbone, and then finally the jaw. So they've found that actually treating a trigeminal neuralgia might actually improve migraine symptoms. Now, this is something that physical therapy can also help with. We're going to dive down a little bit of an anatomy rabbit hole, but I think it's important for you to understand where I'm going in the anatomy and the kind of the mechanism behind it. So even if you're not your healthcare provider, you can explain this to your healthcare provider or have them look at it as well. So the trigeminal nerve has these three branches that go to the face, but there is one big bulb or collection of the nerves within the skull itself called the ganglion. This trigeminal ganglion, or this kind of big bulb of the nerves before they branch out, is located by a really important bone in your skull called the sphenoid bone. Now, the sphenoid bone is important for a couple reasons. One reason, it's where your pituitary gland sits. And also, it is an anchoring point for your dura. Now, your dura, as I describe it, is like the saran wrap, the plastic wrap around your entire nervous system. It is continuous through your central and peripheral system. It anchors in two places. One is your tailbone, also called your coccyx, and the other is your sphenoid bone. If you've listened to my first episode on the hierarchy of the organ systems, you'll know that the nervous system reigns supreme. So if there's any sort of dysfunction in through these anchoring points of being the coccyx or the sphenoid, it will actually cause changes in through your body, in through your musculoskeletal system to try to alleviate tension on the nerves because it wants to protect the nerves first and foremost. Now, this trigeminal ganglion is actually sitting right by the sphenoid bone. And the second branch, the one that goes to your cheekbone, is actually coming out through a hole in your sphenoid bone. So if the sphenoid bone is off, it could actually be doing this increased pressure or tension on the trigeminal nerve ganglion. So if you have someone mobilize and get that sphenoid sitting in a neutral position, so there's not this abnormal tension, it could potentially take pressure off the trigeminal ganglion that might be a cause for your migraines. I know that's a lot of anatomy and it could feel very overwhelming, but thank you for sticking it out with me. Just realize that if you suffer from migraines, there could be an answer other than just medication. So if you are one of those migraine sufferers, just remember trigeminal nerve and sphenoid bone. And hopefully you can find a healthcare provider that will assist you in mobilization and see if that might be a cause of your migraine pain. If you're really struggling with headaches, I suggest that the next time you go to see your medical provider about it, you come armed with as much information about your headache as you can. Because remember, there's over 300 different classifications and types of headaches. So there's a lot to try to go through. And the more information you can give your healthcare provider, the better chance they are at finding out how to help you. So when looking at doing a headache diary, it's important to be as specific as possible and to actually write it down. This shouldn't be something that comes off the top of your head that you just kind of say back to your healthcare provider. It should be something that's physically written down that they can also keep to review later. Now, you want to be as specific as possible in terms of when the headache comes on. So what time does it start to come on? And what are you doing at that time? Is there a certain activity that you're doing that correlates with it as well? Then you want to quantify and qualify it as much as you can too. So quantify it. You want to be able to say how intense it is. How long does it last for? When is the height of the headache occur? And then when does it start to dissipate? You want to then also qualify it. So is there a place that the headache starts from and then expands from there? Where is the headache in your head specifically? How does it feel? What sort of characteristic properties do you give it? The information that you're writing down in your headache journal is really important to then be able to try to extrapolate any sort of common causes or patterns that might be occurring with your headaches. And this information will help figure out what type of headache you might be having or different causes and triggers. And more importantly, maybe how to get your headache better. Now, it's important that these headache journals don't go on forever because it is a tendency when someone has to focus on their pain that then it becomes all consuming and that's all they think about. We don't want that as healthcare providers. We don't want you to only focus on your pain. So when I give this as an exercise for a patient, I only have them do it for a few days and then try to forget about it. And it's my job to take that information and try to figure out what patterns can be occurring or what could be the cause and triggers of the headache. But it's important to come to your healthcare provider with as much information as you can and be as specific as possible if they're going to help you. Headaches can be very debilitating and all-consuming of your life. So I hope this episode has helped you learn a little bit more about different types of headaches, where the headaches might be coming from, because it might not be your head, different treatments that you can maybe do on yourself or find a medical provider to help you with. And finally, when you're still struggling, how to arm yourself with as much knowledge as you can so you can get the help that you deserve. Thank you for tuning in to this episode of the Body Fusion Therapy Podcast. Please share it with your friends and family, as well as leave a review if you liked what you heard today. We're looking forward to continuing this journey of looking at the body. Tune in next time.